Some ongoing clinical trials in that space. So international studies currently, one is using there are two actually using the Calum drug, which basically is an antibody that is designed to hopefully resorb the amyloid more quickly. And so one trial is for patients with stage 3A and the other is for stage 3B. And hopefully we'll see in these patients with really truly unmet need that by adding this antibody, patients will have a better overall survival and will reduce that early death rate. Similarly, Prothena has the NeoDO1 drug that is looking at patients with stage 4 AL amyloid, and they, again, an antibody to help resorb the amyloid fibrils more quickly in patients that are sicker. So those are really looking at that population that often is ignored to some extent because they are so sick, these high-risk patients. A number of, we're wishing and hoping for some of the exciting other immunotherapies that are existing in the myeloma space to be moved into the AL space, and several studies are in design and hopefully will be coming to help our patients. In terms of response, again, measuring those free light chains is imperative. Following the cardiac biomarkers is also important. Understanding that sometimes even the cardiac biomarkers can go up the first few cycles, and if they are persistently elevated, then one needs to contemplate changing therapies because perhaps the therapy is too toxic for the patient. Always a trick in treating patients with AL is that it's not always the disease's fault that the patient is doing worse. Sometimes it is actually our medications. There are also some interesting studies coming up to address the observation in patients with multiple myeloma that venetoclax has really great effect in patients whose plasma cells contain the translocation 1114, and there have been case series to this point demonstrating that effect in patients with AL as well. So be on the lookout for clinical trials using the venetoclax with dexamethasone or in other combinations.